Okay, the next one is Marianne Keenan.
This society always gives 2 resident awards for outstanding papers in honor of 2 of the people who started the idea of ortho rehab at Rancho, Dr. Perry and Dr. Nichols. And the first recipient of the Perry Award this year, Marianne Keenan, is going to give a lead in about Dr. Perry.
Well, thank you very much for inviting me to give a talk here. And let me congratulate the winner of the Dr. Perry Award. Dr. Perry was really a very remarkable woman. She was one of the first female orthopedic surgeons, and not only was a pioneer, but she developed so many new techniques and expanded knowledge, especially around function. In speaking with Dr. Perry, it was interesting. She divided her life into pre-orthopedics and then orthopedics. This is a picture of her as a baby shortly after she was born in Denver. And then she said they began traveling early. She's on an Eastern beach here, cute little thing. And then early on, she developed an interest in the outdoors. Let's see. This is a cute picture. She said, age 5, my mother tried, but this fanciness, including the ringlets, soon passed. When she was 10 years old, she got her first tool chest, and her hobbies included carpentry, hiking, and camping. She earned her bachelor's degree in physical education from UCLA in 1940, and then went on to serve in the Army as a physical therapist during World War II. During the time as a physical therapist in the Army, she noted that most of the physicians really didn't know how to examine a patient or have an idea of their function. And she thought, I could do this better. I think I'll go to medical school. So that's what she did. She went to UCSF for medical school and then residency. She completed in 1955. And then it became a question of where to go. Where does your career go next? And there were very few opportunities for women. But Dr. Vernon Nickel invited Dr. Perry to join him at Rancho Los Amigos Hospital in Downey, California. And this was at the peak of the polio epidemic. And so that's where she got started. She was a chief of the polio service. She invented the halo immobilizer with Dr. Nickel, used it for long cervical fusions for polio head instability, and then the long spine fusion for lower paralytic instability. The key really was to find a way to be able to get the patient stable so that they could sit up in bed, interact with people, and then have the ability to undergo some functional rehabilitation to try and see what best they can do. Dr. Perry told an interesting story about first arriving at Rancho, and she and Dr. Nickel, as well as Dr. Armin Fisher, who was a pulmonologist, they went around to see each of the patients in the iron lungs, and they would turn off the iron lung, pull the patient out. If the patient could breathe adequately on room air and without the support, then they stayed out of the iron lung and began their rehabilitation. And the first lesson they learned was to avoid contractures because these people had been lying in the iron lungs and not getting any range of motion to their limbs. If they didn't have adequate respiration, obviously they were returned to the iron lung. And then Dr. Fisher took over, attempting to improve their pulmonary function. Dr. Perry was invited all over the world and had many important visitors come. So this is Elizabeth Dole visiting and Dr. Perry demonstrating the Halo tour. On the polio service, she also developed functional hand and upper extremity orthoses. Her contributions to anatomy were that she co-identified the VMO with Fred Lieb and also described and classified neck muscle paralysis and stabilization surgery. She pioneered the anterior approach to the cervical spine. She moved on then to pathokinesiology and established a gait laboratory with clinical gait studies using an EMG analyzer, the footstep devices in shoe to be able to measure step length and stride. And also, one of the important things was she developed a system for superimposing a laser vision of the ground reaction force over the patient's video walking so that you had an immediate understanding of where the line of forces were going relative to the joints. She also worked to understand the etiology of these deformities that you would see. Dr. Baldwin talked about equinovarus previously. So then she developed the method of dynamic EMG, measuring the muscle activity during walking. And these were the foot switch indicators. So this is stance and then swing, stance, swing. And based on this, she developed a number of different surgical procedures, including the split anterior tibial tendon transfer. For the polio patients with their paralytic deformities, the entire tendon of the tibialis anterior would be transferred to the midfoot to gain dorsiflexion. But with a spastic patient, she noted that if the insertion of the entire tibialis anterior tib tendon was not fully centered in the foot, then you got varus or valgus with dorsiflexion. So she thought, well, let me split this into two pieces so that we'll have equal pull on both sides of the foot in a predictable manner. The pathokinesiology lab just became more and more sophisticated. Her next foray was into post-polio syndrome. She had treated so many people with polio early in her career that then they began returning to her with complaints of new muscle weakness and decreasing function. So she founded the post-polio clinic at Rancho Los Amigos and discovered that the new weakness was caused by a lifetime of muscle overuse. So then she developed techniques for stabilizing the patient and further compensating for the weakness. She then moved on to sports medicine. She just kept following all the latest trends and needs. And she became a consultant at the biomechanics lab at Centinela Hospital in Los Angeles. And she was involved with the classic early studies of rotator cuff injuries in the professional throwing athlete. She had many awards and honors. She was the LA Times Woman of the Year. She had 33 major honors, including Kappa Delta, Alumnus of the Year for UCSF, Shands Lecture for the AOA, and many, many more. 1996, an honorary doctorate from the University of Southern California, Shands Tribute Lecture, Lohman Award, Lifetime Achievement Award for the Gates Study. She had visiting professorships all over the world and honorary memberships in the American Physical Therapy Association and the American Academy of Orthotists and Prosthetists. Lots of grants, 8 grants from 1962 to 1999. 3 of them were from NIH. 8 were from NIH, excuse me. 3 from NIDRR, VA, 10 grants, and then she had many others. In March of 1981, she was invited by Mrs. Sadat, the First Lady of Egypt, to come and visit their rehabilitation programs and give some advice. Dr. Perry finally retired in 1992. And by retired, she said that she just works without pay. She still went to work every day. She had many, many publications, peer review, books, chapters, and so forth. And she wrote the definitive textbook on gait analysis. And this is showing the second edition of her textbook, which she completed when she was in her 90s. One of the biggest honors of all is that at Rancho Los Amigos, they built the Jacquelin Perry Institute. This opened in 1992. But one of the things she always did, she never stopped thinking. This is a photograph that her associate Joe Gronley took when they were on a hiking trip. They took many hiking trips. And there was Dr. Perry with her laptop still working, while she's enjoying the outside. So she was really a very remarkable woman. I feel very honored to have had the chance to know her and work with her. She was teacher, mentor, and good friend. So we're all very proud to have known Dr. Perry. Thank you.